One of the Shafi view is that the woman should do ghusl for each salah. Okay? If she's unable to differentiate between the blood types and doesn't know how many days her previous habit was before she became mustahadah, meaning before she had this problem of istihadah, because there is a chance, there is always a chance that she might be in tuhur, or there's always a chance she might not be, because she doesn't know. But this is a very strict way of looking at the issue, because the woman herself would be, she can't live life like that. It's very, very difficult. But it is a view depending on, but the normal Shafi view is not that. Okay? The Hanbalis and Shafis, they categorize a woman, she suffers from istihadah, a bleeding all the time, other than her menstruation. They say the first type is a mubtadi'ah, meaning a beginner, the first time bleeding, but the blood can be differentiated by color and smell. Okay, her issue is simple. The days is fresh blood is the istihadah, and the days which is not fresh, the dark or red blood, dark red or black and foul smell. If she can differentiate, okay, she can observe her menstruation and observe her clean period accordingly. That's easy, because she doesn't have a previous. That's very important, because a woman, before she had this problem of istihadah, if she had a previous habit, that's very important. If she used to previously always have menstruation for, let's say, 5 days, okay, she knows how much days she has. But we're talking about a new person, a girl, she has just started a menstruation, and then she's had a problem where she doesn't stop bleeding. Now she doesn't know how many days her menstruation and how many days is just normal bleeding. So if the blood is different and is able to differentiate, she is able to differentiate, I think she'll go by that. But the problem is, if she is a new starter, but there is no way for her to differentiate. Her blood is not very clearly, some people bleed so little that, or her istihadah bleeding is so heavy that it's impossible for her to differentiate what is menstruation and what's not. That's the problematic case. In that case, she can go with the hadith, the 6 to 7 days a month she will observe as menstruation, and the rest of the days she will observe as clean period. Some Shafi'is, they said, well, she would see what the normal bleeding days are in her family, the woman, her sister's mother, and so on. If everyone bleeds 6 days, she will observe 6 days. If everyone is 8 days, she will observe. That's one view as well. That's in the case where she doesn't have a previous habit, because she's new to this, and she cannot differentiate. That's a rare case. Okay, but it does happen. But many times, women who go through istihadah, they don't start their menstruation the first time with istihadah. They are okay for years, maybe, or months, or even decades before they actually have a problem. So, where is Mubtadi'ah was a new person bleeding for the first time. Mu'tada is a category which means before she was afflicted with this problem of istihadah, she had a normal cycle. Now she has different rulings. Let's say a woman, she had a cycle, a habit and a normal cycle before she got into the problem of istihadah. That woman, firstly, let's say she can clearly differentiate between the blood. That's my menstruation and that's istihadah. Okay, she'll observe a menstruation and istihadah accordingly. So that's called mu'tada mumayyiza. She has a habit and she can differentiate. That's easy. So we had two cases in the newcomer, where a new person who was bleeding for the first time, either she can differentiate, either she cannot. That's two cases. For someone who has previously has a habit, she can differentiate. That's mu'tada mumayyiza. Okay? But the problem comes if she cannot differentiate between the blood. She had the number 4 is a woman. She's mu'tada, meaning she had a previous habit and cycle, but she cannot differentiate between the blood anymore. So her case is depending on whether she can remember what she used to have or not. Let's say she can remember. She can remember how many days she used to have menstruation, and she can remember when she used to have it. Clear? A woman, suddenly she is afflicted with a istihadah, and she cannot differentiate between the two different types of bleeding. But she remembers how many days all her life she's been having menstruation and when she has it. Women can calculate when's the next one due. So she knows mine is 5 days and it is due in the first week of the next month. So she has a previous habit, even though she can't differentiate between the bleeding, but she can remember. She can remember her cycle and she can remember the number of days. So she will go with that. She will observe, she will base it on what she remembers every month, that many days menstruation followed by that many days of clean period. She'll just base it on that because she cannot remember, she cannot differentiate between the blood, but she knows when her menstruation was due. Clear? Okay. So that's easy as well. So you had someone who had a previous habit and she can differentiate in the blood. That's easy. But someone who cannot differentiate in the blood, but she remembers when the menstruation is due and how long it is. Clear? Okay. The problem comes when someone who had a previous cycle, she knows when the next one is due, but she's forgotten how many days do I normally have bleeding. Or she can remember how many days she has bleeding, but she can't remember when the next one is due. Maybe she had it for a few months, but she never paid attention how many days, because bleeding starts, stops praying. When it stops, do ghusl and start praying. Never thought of how many days. So now there are two possibilities. She had a previous habit, and now she cannot differentiate between the blood. When she had istihadah, she cannot differentiate between the two different types of blood, menstruation and non-menstruation blood. But she can remember one of the things. Either she can remember how many days her menstruation was, or she can remember when the next one is due, but she can't remember both. That's problematic. All right? And there is a bigger problematic one where she cannot remember how many days she had menstruation and she can't remember when it is due, and she cannot differentiate between the blood either. So in that case, if she can't differentiate between the blood and she can't remember anything, she will be like the new starter. She will start again. She will observe beginning of the month so much, and then she will have so many days of, like a newcomer would have, like a new mustahadah. And as for the one who forgotten either the time or either the days, so she will observe the time observe the time. Let's say she knows how many days she is due, but she don't know when. So she will either do beginning of the month, or she will take her best guess and she will just start the cycle from there. But every month she will then do that many days. Or she knows when it is due, but she can't remember the days. So she will either do 6 to 7 days, or either she will follow the woman. But this is maybe if someone follows Shafi madhab or Hanbali madhab, if they are afflicted with that, they should consult a alim, because these masail doesn't actually have one answer. It is much more deeper than just to give one answer. But in general, these are the categories. Clear?